I'm Matt Willis, Public Health Officer for Marin County, with an important update on COVID-19 treatments. Last week, about 500 doses of Paxlovid, which are pills used to treat COVID-19, arrived in most pharmacies across Marin County as part of a federal program with our chain pharmacies. It happened without a lot of fanfare, but is a key milestone in our pandemic response. This basically means that for the first time since the beginning of the pandemic, we have enough medications in Marin to effectively treat everyone who should be treated for COVID-19. Here's why it's so exciting to have more treatments available. As you know, Marin County has among the highest vaccination rates in the nation. And that's great news because vaccinations alone reduce risk of death by about 90%. In fact, our vaccination rates are the main reason why our death rates are among the lowest in the nation. And that's despite being a community made up of a higher number of older residents. So while vaccines are our best line of defense, they aren't 100%. Paxlovid can reduce the risk of death in people who are at highest risk by another 90%. So let's look at these two together. A 90% reduction in risk of dying by being infected, and now on top of that, an additional 90% reduction in risk of death if you receive timely and appropriate treatment. For the first time, we can visualize a community with zero COVID deaths. Saying that no one should really be dying from COVID-19 would have been unimaginable last year at this time. So while treatments are a game changer, here's a critical point. Most people infected with COVID-19 don't need any treatment, and in fact wouldn't benefit. These treatments are serious medications with interactions with other medications and potential for side effects. The use of these treatments are reserved for those few who are at the highest risk for bad outcomes. If I got COVID-19, I would not be recommended for Paxlovid most likely because I'm fully vaccinated and boosted, and I wouldn't qualify for treatment because the risks would probably outweigh the potential benefit for me. But for those who are at real risk for hospitalization and death, this increased access is potentially life-saving. So here's the message. We focused on that group of people at the highest risk for severe outcomes at various stages in our pandemic response, usually around being prioritized for vaccines or boosters or avoiding exposures and using proper face covering. That's the same group we think about for treatments. People over age 65, people who are not or cannot be vaccinated, or anyone aged 12 years or older with a serious chronic medical condition should keep home tests at hand and self-test if they develop symptoms of COVID-19. If the result is positive, call your doctor to talk about possible treatment. Treatment is taken at home through a prescription and should be started within 5 days of when symptoms began. So it's important to test promptly and reach out to get treatment process started if you're at risk. To make access even easier, starting next week, some sites in Marin will be offering testing on site with access to medication then and there for patients who meet criteria. This is called Test to Treat, and we're starting with 3 Carbon Health clinics in Novato, Santa Fe, and Mill Valley. This progress in removing barriers to treatment comes at a particularly good time for us as case counts continue to rise across the region. We're fortunate to have excellent healthcare providers across the county who have stepped forward to meet our needs at different stages, including testing and vaccinations. Now, the role of healthcare is even more critical as we remove any barriers to life-saving treatments and move a step closer to zero COVID deaths. Thank you for doing your part.